Welcome. We'd first like to extend our gratitude to the organizers of this event for providing this opportunity and to Harris Health for delivering an excellent prompt. We are thrilled to present our recommendations for your organization. Please allow me to introduce our team. My name is Sydney and I had the privilege of acting as the team lead. My colleagues and the people who made this proposal possible are Nagma, Nicholas, Maxim, and Cheryl, who will tell you more about our approach.
Our client that we are aiming to serve is the Harris Health System, a community-focused academic healthcare system dedicated to improving the health of those most in need in Harris County through quality care delivery, coordination of care, and education. Here is an executive summary of our presentation. The key question to answer is how should Harris Health use remote patient monitoring, RPM, to maximize the care provided to its patients with chronic disease conditions. The objectives are to find the gap of unmet needs that require expanded RPM, determine the most efficient way to implement monitoring plus AI data analysis, and compare different RPM device options. The approach involves defining the patient demographics who are in need of RPM and identifying the diseases that can be covered by current devices. Finally, our recommendation is that Harris Health should partner with CareSimple for RPM devices, use Giant as the AI processor, and acquire health coaches. It is important to first know the patient population to have a better idea of the patients targeted by the RPM program. Of the total patient population, 214,000 have chronic conditions. Of our target patient population, 45% speak Spanish, 56% are uninsured, and most patients who need the RPM are between the ages of 50 to 84. Research shows that 70% of patients with chronic conditions say they want more resources to monitor their disease, and RPM device usage reduces hospital admission rate by 76%. With this information in mind, we need to customize the RPM program to better serve this specific patient population.
So in order to expand RPM to the desired patient population, Apex Consulting found that the most suitable RPM service is CareSimple. Now, although CareSimple and Harris Health's current vendor, Livongo, share some capabilities, CareSimple has a number of distinguishing services that really make it competitive when compared to Livongo. So in addition to offering blood pressure monitors, blood glucose monitors, as well as body weight scales, which are all 4G enabled, CareSimple is also capable of servicing patients suffering from a wide variety of chronic diseases, such as COPD and congestive heart failure. Additionally, CareSimple is partnered with HealthWise, a health education tech firm specializing in helping patients understand their medical products as well as their ailments. And furthermore, CareSimple can also onboard all existing Harris Health patients onto their platform and has a remote care services patient provider service, which allows Harris Health to employ a ready-made team of medical staff to service patients on behalf of Harris Health. And to continue to use Harris Health's patient portal, CareSimple also provides APIs to facilitate the connectivity between this and CareSimple's platform. And finally, not only is CareSimple compatible with Epic, but it's also compatible with a number of non-CareSimple devices. So when you compare Livongo, CareSimple is by far a more superior software because it provides a more comprehensive RPM program that can be scaled fairly aggressively. Now, I'm going to turn it over to my colleague Nagma, who's going to discuss an additional solution.
Due to the increased prevalence of artificial intelligence implementation in healthcare, Epic and other companies are adding AI components that will ease the burden on physicians and help coach patients to take care of their health more responsibly. Our research shows that Giant is an ideal health AI candidate for Harris Health to pair with CareSimple. Giant can converse with patients, understand their symptoms, and send data to doctors who would then provide diagnosis in real time. Additionally, Giant expands patient access, digitizes patient journey, and provides care navigation with tailored messages through its decision support software, DSS. Giant increases productivity and reduces costs for HCPs as well. One of Giant's most relevant features is its ability to communicate with patients in multiple languages. Giant has developed a detailed plan for COVID-19, which includes deploying a virtual assistant chatbot on hospital website, mobile apps, and patient portals to help patients and hospital staff screen for infection, get questions answered, learn about testing options, schedule vaccine appointment, and stay safe for going back to work. In addition, CareSimple's COVID strategy involves customizable template and patient charts specific to COVID-19. They also provide support for a broad spectrum of chronic diseases, which share similarities to most long-term COVID symptoms, including breathing issues, heart and kidney problems, and diabetes. Now, Sydney will talk to you about implementation.
We believe that our approach will be unmatched in its ability to drive patient retention and success because our proposed plan includes a community-focused health campaign to supplement the RPM rollout. This campaign will ensure high levels of patient involvement, streamline the recruitment of new patients, and ensure that patients continue using their RPM devices, providing them with the best opportunity to manage their chronic conditions. We'll start by segmenting the population and creating targeted health campaign messages that fit a narrow audience, specifically one made up of patients over the age of 50 who have hypertension or diabetes. Recruitment will involve in-clinic discussions, phone calls, and digital outreach to eligible participants. Studies show that people over the age of 50 are particularly receptive to gain-framed messages which highlight incentives and positive behavior changes that drive improved outcomes. Onboarding events consisting of demonstrations that show patients exactly what to expect will increase each patient's self-efficacy, which is the strongest indicator of patient adherence. Social support groups, on-site health coaching, and regularly reoccurring financial incentives provided by the community partners offer added levels of patient support. With that, Maxim will explain how we'll scale our program.
We developed a rollout plan designed to enroll all 214,000 patients in Harris Health System with chronic illness in our RPM program. In order to do this successfully, we are utilizing a stepwise approach. The first step in our rollout begins with enrolling 5,000 patients with hypertension and diabetes. These patients will be monitored for 12 weeks, which will be sufficient time to troubleshoot any potential issues. After the initial 12 weeks, we will add an additional 7,500 patients with congestive heart failure, cancer, and COVID-19. From there on, every 12 weeks, we will enroll additional patients in proportional increments to enroll all 214,000 patients within 3 years. Regarding the financials of implementation, the figures were calculated by determining prices per patient per month, then processed accordingly based on our patient enrollment plan numbers. Gross savings were calculated by adding reimbursement through insurance and Medicare credits, and costs saved by reducing hospitalizations. Total expenses were calculated by adding the costs of CareSimple, the patient incentive program, supplemental health coaching, and the AI platform. These values were calculated using values from Harris Health's patient demographics, case studies, and credible databases. Assuming 100% enrollment, this plan will cost about $825 million annually in 3 years. While we are proposing an ideal rollout that improves the lives of as many patients as possible that assumes 100% enrollment, we realize that patients may decline to enroll. Therefore, we also calculated the costs of our plan assuming 50% enrollment, which is a reasonably achievable value based on some previous and current models. As you can see, the 50% enrollment plan reduces total cost significantly. While our plan is indeed costly, we believe that the positive patient outcomes, such as increased survival, quality of life, and reduced hospital time, vastly outweigh the cost.
High-touch RPM programs improve outcomes and provider-patient relationships. Health coaches can act as patient navigators, and our approach ensures that this program reaches the patients who need it the most. So the solutions we're suggesting go beyond the scope of traditional medical care and offer on-demand, culturally competent solutions to the issues faced by the diverse population that Harris Health serves. Considering the robust nature of CareSimple's ability to roll out RPM programs at scale, Giant's artificial artificial intelligence capabilities, and the comprehensive nature of our health campaign, Apex Consulting recommends that Harris Health implement these changes. We believe that these suggestions comprise the answer to the question, what does the ideal Harris Health RPM solution look like for managing chronic conditions?